Yes, good afternoon to all. So in last class we discussed what is the definition of general anesthetics and stages of general anesthesia and classification of general anesthetics and mechanism of action of general anesthetic drugs. Okay, so in today's class, I'm going to explain about the individual general anesthetics drugs characteristics and complications of general anesthesia also. So first one is general anesthetics are divided to two types. So that is inhalation anesthetics and intravenous anesthetics. Okay, so here what is the example of inhalation anesthetics is what diethyl ether. Okay, so here diethyl ether, it is a colorless. Okay, it is a colorless solution, and it is a colorless liquid, and it is a highly volatile liquid with the pungent odor, and the boiling point is 35 degrees centigrade. Okay, and it produces the more irritating vapors. Okay, because of this diethyl ether, it is highly inflammable and it is highly explosive. So that's why it is irritating. It produces a more irritating vapors, and it is irritated the nasal ways also. Okay, air passageways also irritated by diethyl ether. Okay, and what is the pharmacokinetics? So here, 85 to 90% of this diethyl ether, it is eliminated through what lungs region, and the remaining thing it is eliminated through skin, urine, milk, and sweat. Okay, because of this one is inhalation anesthetics, and this diethyl ether is does not crosses the placental barrier. Okay, and what is the advantages of this drug, diethyl ether? Okay, here, so this diethyl ether, it can be used without complicated operators, and it is a most potent anesthetic drug, and it is a good analgesic drug, and it produces a muscle relaxation. Okay, diethyl ether causes the muscle relaxation, and this drug having wide safety of margin, and it is stimulate the respiration, and it causes the bronchodilation also. And this diethyl ether does not sensitize the heart to adrenaline, and it is very cheap, and it can be used in delivery, and it is less likely to cause the what hepatotoxicity and nephrotoxicity. Okay, less likely hepatotoxicity and nephrotoxicity. So these are the advantages of the diethyl ether. And what is the disadvantages? It is a very inflammable and it is a very explosive. Okay, it is a major disadvantage of diethyl ether, and it is a slow induction. Okay, why it is slow induction means the time required to the induction of the anesthesia is very more. Okay, the time required to induces the anesthesia is very more. Okay, and it is a slow induction, it is a very unpleasant, and it is a slow recovery also. Okay, why it is slow recovery? Means slow recovery means what here? The time required to recovery is also very more. Okay, so here the nausea and vomiting is occurs. So during the what during this phase, during the recovery phase, the person might be get the what nausea and vomiting. Okay, and during the induction time, during the induction phase of this diethyl ether, when we are giving the diethyl ether, so here the respiratory secretions are increases. So that's why here we have to use the word atropine drug to minimize the all gland secretions. Okay, and it is very unpleasant, and it is a slowly induces the anesthesia, and the time required for the recovery is also very high. Okay, and the cardiac arrest is also occurs, and the convulsions in children is also occurs. Okay, so nothing but the involuntary muscle contractions is occurs in the children's. Okay, and ether not used now. Okay, except in resource poor areas. Okay, why it is not used in nowadays? Why this diethyl ether not used in nowadays? Because of due to unpleasant. Okay, it is unpleasant, and this drug mainly having the inflammable property and explosive properties. So that's why this ether, diethyl ether, is not used now. Okay, except in resources poor areas. Okay, so why it is not used? Because of unpleasant, and it is very unpleasant, and it's diethyl ether having the inflammable properties. Okay, that's why diethyl ether is not used now. Okay, and next one is nitrous oxide. Okay, so it is a colorless gas, and it is a odorless inorganic gas with a sweet taste. Okay, and it is a non-inflammable and is non-irritating, but the drug having that but is having low potency. Okay, and it is a very potent analgesic drug. Okay, and why it is very potent analgesic drug? Because of this nitrous oxide, it is used along with another anesthetics, another potent anesthetics drugs. Okay, so that always nitrous oxide is used along with another anesthetics agents, and used along with oxygen. So why nitrous oxide is always used along with oxygen? Because of this nitrous oxide is causes the hypoxia. What is hypoxia? Hypoxia means there is a lack of oxygen supply to tissues. That is called as hypoxia. So this hypoxia is caused by what? Nitrous oxide. Okay, so that's why this nitrous oxide, it is always used along with oxygen. Okay, and it is a very potent analgesic, and it is used along with what? Another general anesthetics. Okay, for example, here the 70% of the nitrous oxide, it is used along with 25 to 30% of the what? Oxygen, and 0.2 to 2% of the another potent general anesthetics drugs. Okay, so when nitrous oxide, when it is used along with another general anesthetic drugs only, it can shows the analgesic effect. Okay, and this the single nitrous oxide agent is used with oxygen in dental extraction. Okay, it is used in dental extraction, and it is used in obstetrics. Means it is a branch of science. It deals with what? Pregnancy and childbirth. Okay, so uh, what is the advantages of this nitrous oxide? Nitrous oxide advantages: it is a non-inflammable and it is a non-irritant, and it is a the nitrous oxide, it is induces the anesthesia very rapidly, and the recovery is also very rapid. Okay, and it is a very potent analgesic drug when it is used along with another potent general anesthetic drugs only. Okay, and there is no induction of the nausea and vomiting, and it is a non-toxic to liver, kidney, and brain. Okay, and what is the disadvantages? It is not potent alone. This one is major disadvantage. What is the advantages? Is a very potent analgesic drugs, even though at low concentration, but it is always used along with another potent analgesic drugs, and it is always used along with what? Oxygen. Why it is used along with oxygen? Because of to minimize the effects of hypoxia. Okay, and disadvantages: not potent alone, and it is induces the hypoxia. That is a major disadvantage. So that's why we have to use the oxygen along with nitrous oxide. Okay, and this nitrous oxide, it is inhibit the methionine synthetase. Okay, it is inhibit the what? Methionine synthetase. So what is a methionine synthetase? It is a precursor. This precursor is required for the DNA synthesis. Okay, so here the nitrous oxide drug, it is inhibit the methionine synthesis enzyme, is nothing but it is inhibit the DNA synthesis also in cell. Okay, and this nitrous oxide, it is inhibit the vitamin B12 metabolism also. Okay, it is inhibit the vitamin B12 metabolism, it inhibit the DNA synthesis, and it causes the hypoxia, and it is not potent alone. That's why, because of it induces the hypoxia, and it is always used along with oxygen. Okay, and when it is used along with another general anesthetic drugs only, it produces the analgesic effect. Potent analgesic effect is occurs with the use of another general anesthetic agents. Okay, and next one is halothane. Okay, and next one is halothane, and this one is what fluorinated volatile liquid. Okay, this one is fluorinated volatile liquid with a sweet odor. uh, it is a non-irritant and it is a non-inflammable, and it is applied in amber color bottle. Okay, and it is a potent anesthetic agent, and the 2 to 4% of this halothane is required for the induction of the anesthesia, and 0.5 to 1% of this halothane is required for the maintenance of the anesthesia, and the boiling point of this halothane is 50 degrees centigrade. And here the pharmacokinetics here, the 60 to 80% of this drug halothane, it is eliminated in an unchanged form, because of it is not metabolized in the body. 60 to 80% of the drug, it is not metabolized in the body, so that's why it is excreted in an unchanged form. And the 20% of this the 20% of this halothane, it will be retained in our body and for 24 hours. So after that 24 hours, the drug should the remaining the 20% of the drug, it is metabolized in the liver, then it is excreted through the urine. Okay, and what is the advantages and disadvantages of halothane? Okay, so what is the disadvantage here? So what is the advantage? It is a non-inflammable and it is a non-irritant. Okay, and here the pharyngeal and laryngeal reflexes, it will be decreases. Okay, that is a major advantage. Okay, there is a inhibition of the pharyngeal and laryngeal reflexes, and it causes a bronchodilation. Mm, and it is a potent induction and it is a potent recovery. Okay, the time required to induction of the anesthesia is very less, and the time required to recovery phase is also very less, and it is induces the controlled hypotension. Okay, and it is inhibit the intestinal contraction and uterine contraction. Okay, these are the advantages of the halothane. And what is the disadvantage? Okay, so the administration of this halothane requires special apparatus, and it is a poor analgesic, and it is induces the poor muscle relaxant effect. It produces the poor muscle relaxant effect, and this hypotension is also occurs. Okay, and here there is a decreases the sympathetic activity, and here the arrhythmia is also occurs. Why arrhythmia is occurs? Due to activation of the vagal ganglia. Okay, due to direct vagal stimulation, there is a arrhythmia is occurs, and direct depression of the sinoatrial node, and there is a lack of the baroreceptor action. So due to these effects, the arrhythmia is occurs. Okay, so the arrhythmia is occurs due to stimulation of the vagal nerve, and direct depression of the SCA node, and what there is a lack of baroreceptor action. Okay, so that's why here the hypotension is occurs, and arrhythmia is also occurs, and the respiratory depression is also occurs, and it decreases the urine formation. So why it is decreases the urine formation? Because of this halothane drug is decreases the glomerular filtration rate. So that's why it decreases the urine formation, and it causes the hepatitis. This halothane, it causes the hepatitis, especially 1 in 10,000 of patient. Okay, out of 10,000 population, the 1% is affected with hepatitis. Okay, because of the 20% of this drug is metabolized in the body, and it produces the toxic metabolites. Okay, so that's why the hepatitis is occurs. Okay, and this next one is malignant hyperthermia is occurs. Okay, so this malignant hyperthermia, it is rarely it is occurs in the persons who are having the abnormalities in the rhinodide receptors. Rhinodine receptors. The persons who are having the abnormalities in rhinodine receptors. Okay, in that persons, the malignant hyperthermia is occurs because of actually these rhinodine receptors are regulate the calcium ion channel. Okay, it regulates the opening of the calcium ion channel at the sacroplasmic reticulum. Okay, the sacroplasmic reticulum of the which muscles? The skeleton muscles. Okay, ryanodine receptors are regulate the release of calcium ion channels. The channels which are present at the sacroplasmic reticulum of the skeleton muscles. So here, our halogen drug, it is stimulate the opening of the that calcium ion channel, the channel which is present at the sacroplasmic reticulum of the skeleton muscles. So as a result of the opening of that calcium ion channel, there is a high influx of calcium ions. So nothing but what will happen? There is a persistent muscle contraction is occurs. As a result of the persistent muscle contraction is what will happen? There is a heat production is occurs. Okay, as a result of the persistent skeletal muscle contraction, there is a heat production is occurs. That is called as malignant hyperthermia. Okay, so this malignant hypothermia, it is mainly occurs in the persons who are having the abnormalities of ryanodine receptors, especially genetically wise. So any genetical mutations occurs in that particular gene, the gene which are regulate the actions of the ryanodine receptors. So in that persons, mainly that malignant hypothermia is occurs because of in that persons the halogen, it triggers the release of calcium ions, and then as a result of the release of calcium ions, there is a muscle contraction is occurs. As a result of the continuous muscle contraction, there is a heat production is occurs. Okay, and the cardiac output, it is decreases with deepening of the anesthesia. Okay, so these are the major disadvantages of halogen. It requires special apparatus and it is a poor analgesic drugs. It causes a hypotension, arrhythmia, respiratory depression, decreases urine formation and hepatitis and malignant hyperthermia, and cardiac output is also decreases. Okay, so halogen having major disadvantages is there. Okay, next enflurane. Okay, so this one is non-inflammable with mild sweet odor, and it is boils at the 57 degrees centigrade. Okay, and it is similar to halogen in action. Okay, except muscle, except better muscle relaxation. Okay, it is similar to halogen in action, except better muscle relaxation effect is occurs. And it depresses the myocardial force of contraction, and it is sensitizes the heart to adrenaline. Okay, but the major disadvantage of this enflurane, it is induces the seizures. Okay, it is induces the seizures. Nothing but feet seizures occurs in the deep anesthesia. So that's why. So this drug it is not used in nowadays. Enflurane. Okay, why enflurane it is not used in nowadays? Because of this drug is induces the fits or seizures in deep anesthesia, and one more reason is it is suppress the myocardial contractility. Okay, so that's why the drug is banned. Enflurane. Okay, the main reason is it induces the seizures. And isoflurane. Isoflurane, it is isomer of enflurane. Okay, it is the isomer of what? Enflurane, but having similar properties, but it is slightly more potent drug, and the induction dose is 1.5 to 3%, and the maintenance dose is 1 to 2%, and the isoflurane administration requires the special vaporizer is required. Okay, the administration of isoflurane required this special apparatus, the special vaporizer is required. Okay, and what is the advantages and disadvantages of isoflurane? Okay, so advantages is it is a rapid induction and it is a rapid recovery. Okay, it is induces a good muscle relaxation, and this isoflurane, it is a good maintenance anesthetic drug. Okay, it is a good maintenance anesthetic drug, but is not preferred for the induction. Okay, why it is not preferred for the induction of the anesthesia? Because of due to pungent. Okay, it is a pungent property is there, and it is a irritant, and so this pungent property, it is not liked by conscious patients. Okay, so that's why it is more preferred for the maintenance of the anesthesia. It is not preferred for the induction of the anesthesia due to pungent property. and there is no renal toxicity and there is no hepatotoxicity, and there is a low nausea and low vomiting. Okay, and the incidence of the vomiting is very less, and there is no dilation of the pupil, and there is no loss of light reflex in the deep anesthesia, and here the no seizures. Okay, but in enflurane consists of the what seizures, so that's why the drug it is banned in India. But here in isoflurane, this isoflurane, it is preferred in neurosurgery. So why isoflurane it is used in neurosurgery? Because of this drug does not produces the seizures. Okay, does not causes the seizures. Okay, and it causes a uterine muscle relaxation also. Okay, and these are the advantages, and disadvantages is a respiratory irritant and is a pungent properties there, and this requires this administration of this drug requires the special apparatus, and respiratory depression is also there, and heart rate is increases due to activation of the beta receptors, and is a very costly medication. Okay, so this one is information about the isoflurane. And next one is disflurane. So disflurane, it is a new anesthetic medication, and this administration of this medication requires the special vaporizer is required, and the special vaporizer is required for the administration of this disflurane drug, and this one is 5 times more potent than isoflurane, but that high concentration is required for the induction of the anesthesia, and this disflurin is irritate the air passageways, and it causes the what muscle relaxation effect, and the advantages are totally similar to isoflurane. Okay, and so what is a measurement of inhalation anesthetics potency? How to measure the inhalation anesthetic potency? So that is MAC means that is minimum alveolar concentration. Means what? Minimum alveolar concentration means it is a concentration. So at this concentration, 50% of the subjects or 50% of the patients have no response to surgical stimulus. So that is known as MAC, minimum alveolar concentration is a concentration. So at that particular concentration, the 50% of the subjects have no response to stimulus. Okay, that is surgical stimulus. Okay, so that is called as minimum alveolar concentration, and that the minimum alveolar concentration is different for each inhaled agent. That minimum alveolar concentration, it is not same for the all inhaled agent, is different for each inhaled agent. Okay, so here the methoxyfluorine having the uh, MAC, minimum alveolar concentration is 0.16 percentage, halothane is 0.74, isoflurane is 1.17 percentage, enflurane is 1.7 percentage, and sevoflurane is 2.05%, and disflurane is 6%, and nitrous oxide it is 104 percentage. Here the nitrous oxide requires a higher concentration to induces the anesthesia. Okay, that's why it is less potent. Okay, and halothane and methoxyfluorine having the uh, halothane and methoxyfluorine, uh, it is also induces the anesthesia even though at the low concentrations. So that's why this halothane and methoxyfluorine it is a more potent drugs. Okay, so the more potent inhalation anesthetic drugs are halothane and methoxyfluorine and isoflurane, enflurane, and sevoflurane compared to disflurane and nitrous oxide. Because of the nitrous oxide requires a high concentration to induces the anesthesia. So that's why it is less potent. Okay, and methoxyfluorine and halothane, even though at the low concentration of this halothane and methoxyfluorine, it produces the more it induces the more induction of the anesthesia. Okay, even though at that low concentration it is induces the anesthesia effect. Okay, so that's why it is a more potent drug, halothane and methoxyfluorine. And here the two important characteristics of the inhalation anesthetics which governs the anesthesia. Okay, which governs the anesthesia are the what is the two important characteristics of the inhalation anesthetics is what? Solubility in the fat and solubility in the blood. Okay, so solubility in the fat is called as oil gas partition coefficient, and solubility in the blood is called as what? Blood gas partition coefficient. So what is oil gas partition coefficient, and what is solubility blood gas partition coefficient? So what is oil gas partition coefficient? So it is indicates the amount of gas that is soluble in the oil. Okay, um, it is indicates the amount of the gas that is soluble in the oil phase. Okay, and it is measure the lipid solubility of the anesthetics. Okay, so this oil gas partition coefficient, it is measure the lipid solubility of the anesthetics, and it measure the anesthetic potency also, and higher solubility of the general anesthetics in oil phase means it shows the greater anesthetic actions. Okay, so oil gas partition coefficient is indicates the amount of gas that is soluble in the oil phase. Okay, and it is measure the lipid solubility of the anesthetics, and it is measure the anesthetic potency also, and higher solubility of this general anesthetic in oil phase means it produces a more uh, greater anesthetic action. Okay, and next one is the blood gas partition coefficient, the ratio of concentration in the blood to the concentration in the gas phase. So that is in contact with the blood. Okay, so the ratio of the what? The concentration of the drug which is present in the blood to the concentration of the drug in the oil in the gas. Okay, in the gas phase, that concentration of the drug which is present in the gas phase, that is contacted with what? Blood. Okay, so for example, that inhaled anesthetics, it is more soluble in blood compared to gas means what will happen? If it is more soluble in the blood means the drug, it will be binds with what? Plasma proteins. If the drug is binds with the plasma proteins means what will happen? The partition, it may leads to the blood, it is increases the blood gas partition coefficient. Okay, means what? If it is binds with the plasma protein, if that gas, that inhalation anesthetics is binds with the plasma proteins in our body means it takes more time to enter the lipid tissues, and it takes more time to induction of the anesthesia. Okay, and then it takes more time to induction of the anesthesia. That's why that's what is called that an increased blood and gas partition coefficient, it is causes the poor induction and poor recovery. If the lower blood gas coefficient is there means the faster induction is occurs and the faster recovery is occurs. Okay, if the drug having high blood gas partition coefficient is very high in that particular, if the inhalation anesthetics having the blood gas partition coefficient is very high means there is a slow induction occurs and there is a slow recovery occurs because of the drug is soluble in more in blood means what will happen? The if it is soluble in blood means it is binds with plasma proteins. If it is binds with the plasma proteins, it is unable to distribute in our body, so nothing but the time required to entering of the lipid tissue is very more. Okay, so that's why the time required to produces the anesthesia is also very more. Okay, so that's why the lower blood and gas coefficient is there means it is induces, if inhalation anesthetics having the low blood gas coefficient is there means it is induces the faster um, anesthesia effect, and it causes the faster recovery effect also. Okay, faster recovery is occurs and faster induction is also occurs if the drug having low blood gas coefficient is there means. Okay, and this one is what? Inhalation anesthetics. Next one is intravenous anesthetics. Okay, example is thiopental. Okay, so it is an ultra short acting barbiturate. Okay, so this one is ultra short acting barbiturate, and this one is high lipid solubility is there, and that's why it is rapidly enter into the brain region, and the rapid onset of action is there. Okay, the 20 seconds of the time is required to induction of the anesthesia, and the short duration of action, the thiopental having the short duration of action, and the effect is terminated not by metabolism, it is terminated by redistribution process. And the risk of severe vasospasm is there if it is accidentally injected to the arteries. Actually, the drug can be injected to the veins region. If it is accidentally injected to the arteries, means the severe vasospasm is occurs, and it depresses cerebral blood flow, and it is decreases the intracranial pressure also. Okay, so this drug may causes a weak muscle relaxant effect and does not irritate the air passages, and it causes the respiratory depression, and BP is also falls immediately after injecting this drug, and the shivering is occurs during the recovery phase, and the off life of this drug is 8 to 12 hours. And the second drug is propofol. Okay, so this propofol is a replacing thiopentone now. Okay, it is an oily liquid, it is used as a 1% emulsion. Okay, and the rapid induction is occurs. Okay, it takes only 15 to 45 seconds after injection of this drug. The anesthesia effect is occurs within 15 to 45 seconds, and the duration of this anesthesia effect is what, 5 to 10 minutes. Okay, and the distribution of life of this propofol is 2 to 4 minutes, and the elimination of life of this propofol is 100 minutes. Okay, and the dose of this drug, the propofol dose is what, for induction purpose, 2 mg per kg IV route. Okay, and maintenance dose is 9 mg per kg per hour IV infusion route. Okay, so here the first 2 mg per kg bolus injection, directly we have to give the injection, and the maintenance dose, it should be mixed with the IV fluids. The 9 mg per kg of this propofol, it should be mixed with what, IV infusions. Okay, and this propofol, it is extensively metabolized. Okay, so 88% of this administered dose, it is appears in the urine. Okay, because of this drug is highly metabolized in the liver, so that's why it is highly excreted through the urine. And the drug, it is metabolized in the liver with the help of conjugation process, and it is conjugated with what, glucuronic acid. Okay, so in phase 2 metabolism process, there is a phase, metabolism consists of two phases, phase 1 and phase 2. Okay, so phase 2 reactions are the conjugation reactions is there. Okay, gluconyl conjugation, glycine conjugation. Okay, and here this propofol drug, it is conjugated with the gluconic acid. After conjugated with the gluconic acid only, the propofol drug, it is inactivated, and that metabolites of this propofol, it is excreted through the urine. And what is the advantages and disadvantages of propofol? It is rapid, induces the anesthesia, and it does not sensitize the myocardium to adrenaline. It does not produce a nausea and vomiting, and it is a non-explosive, and it is a non-irritant also. Okay, and by using this propofol only, we can prefer the minor surgeries. And what is the disadvantages? It is induces the apnea, means it is decreases the breathing. Hypotension is occurs, bradycardia is occurs, and the dose dependent respiratory depressions is also occurs, and the pain during the injection is also occurs. Okay, so that's why the propofol drug, it is used along with another local anesthetic drugs. Okay, so the name of that local anesthetic drugs is lidocaine. Okay, so propofol, while we are injecting the propofol, the pain is occurs. So in order to avoid that pain, we have to use the local anesthetic drugs, that is lidocaine along with propofol. And next one is ketamine. Okay, so this ketamine, it is a phencyclidine derivative. Okay, and this one is dissociative anesthesia. Okay, the category of ketamine, it is induces the what kind of anesthesia? Dissociative anesthesia. What is mean by dissociative? Means it is a state, it is characterized by immobility, patient immobility, and amnesia means loss of memory, and analgesia with a light sleep, and feeling of dissociation. Feeling of what? Dissociation from one's own body and own body and mind also, and their surroundings. That is called as dissociative anesthesia. And the site of action is what? Cortex and subcortical areas. And what is the mechanism of action of ketamine? It is inhibit the NMDA receptors. So the NMDA, it is what kind of receptor? It is excitatory ligand gated ion channel. Okay, so as a result of inhibition of NMDA receptors means what will happen? There is a inhibit the depolarization effect. Okay, and there is no transmission of the nerve impulses from the there is no passage of the impulses from the nerve cells to muscle cells. Okay, and the dose of this drug is 5 to 10 mg per kg IM route or 1 to 2 mg IV route. Okay, so the site of action of this ketamine is cortex and subcortical areas, especially what kind of receptors it is binds, that is NMDA receptors. Okay, uh, what is the disadvantages of ketamine? It is a the slow limb movements is occurs during the process, during the surgery process, and the hypertensive. So ketamine, it causes the hypertension, and it is increases the intraocular tension and increases the intracranial pressure, and uterine stimulations is also occurs, and psychosis and schizophrenia is also occurs, and it causes the laryngospasm, and it causes a poor muscle relaxation. Okay, these are the main disadvantages. And what is the uses of this ketamine is what? um, it is increases the heart rate and increase the BP and increase the cardiac output. Because of it is increases the sympathetic stimulation. And this drug, it is used in head surgeries and neck surgeries, and it is used in asthmatics because of it causes the bronchodilation, and this ketamine drug is used to relieve the bronchospasm. And it is used in short surgical procedures like buns dressings, and forceps deliveries, and it is required for the extraction, manual extraction or manual removal of what? Placenta. Okay, and it is used in dental procedures also. And when it is used along with the diazepam means this process, this ketamine is used for the angiography process and cardiac catheterization also. Okay, so for angiographic, it is our diagnosis test, and cardiac catheterization. So these two processes requires the diazepam along with ketamine. Okay, um, and last one is fentanyl. This one is a neuroleptic analgesia drug, and it is a 4-acycloanilone derivative, and it is an opioid analgesic drug, and the duration of action is 30 to 50 minutes, and it is combination with the diazepam. So when it is used along with the diazepam means it is used in the diagnostic and endoscopic and angiographic procedures. Okay, it is when it is used along with the diazepam means it is required for the endoscopy. It is one kind of diagnostic procedure and angiographic procedures also. And what is the advantages is it is produces a smooth onset of anesthesia, and it is induces a rapid anesthesia and rapid recovery also. It is suppress the vomiting and suppress the cough also during the surgical procedure, and less fall in BP, and there is no sensation to adrenal also. Okay, um, respiratory depression is also occurs, and increase the tone of the chest muscles, and nausea, vomiting, itching during the recovery. Okay, during the surgical procedure, there is no nausea, vomiting, and there is no cough. But during the recovery phase, there is a nausea, vomiting, and itching is also occurs during the recovery phase. Okay, and the chest muscle tone is also increases. The respiratory depression is also occurs. Fentanyl disadvantages. Next, last thing is complications of anesthesia. So what is the complications of anesthesia? So during the anesthesia, some complications is occurs. After anesthesia is also occurs. So during the anesthesia, so there is a respiratory depression is occurs, and salivation and respiratory secretions is also occurs, and the cardiac arrhythmia is also occurs, and fall in BP and aspiration of the inhalation anesthetics, and laryngospasm and asphyxia. Asphyxia means what? Uh, uh, Improper breathing. Okay, and delirium means it one kind of mental disturbances, and convulsions is also occurs, and the fire and explosion is also occurs. Okay, the diethyl ether having the inflammable properties. Okay, so that's why that fire is also occurs and explosion is also occur during the anesthesia. After anesthesia, nausea, vomiting is very common, and persistent sedation and pneumonia is also occurs. Organ damage is also occurs, liver and kidney. And now paralysis is nothing but now compression is also occurs. Delirium, mental disturbances, nothing but delirium is nothing but mental disturbances, and cognitive defects is also occurs. Okay, there is a loss of memory, amnesia is also occurs after anesthesia also. Okay, so these are the complications of the anesthesia. Okay, so this one is total information about the general anesthetics. Okay, so general anesthetics are divided to two types: inhalation and intravenous. Okay, and mechanism of action of this general anesthetics is ketamine drug and nitrous oxide, it is inhibit the NMDA receptors, but remaining all intravenous and inhalation anesthetics are potentiate the actions of the GABA A receptor and glycine receptors. Okay, and here diethyl ether it is not used in nowadays, and one more thing is enflurin is also not used in nowadays, because enflurin is causes the convulsant effect, and diethyl ether having the inflammable properties. Okay, and this isoflurane drug it is only used for the maintenance of the anesthesia. It is not used in the induction of the anesthesia. It is not used for the induction of anesthesia because of the pungent property. Okay, and what? So this see this one is information about the what general anesthetics. So in next class we will discuss about the sedatives and hypnotics.